Hello and welcome back to Dr. Showcares. So today we're going to be talking about a very important topic, premenstrual syndrome. The old name used to be premenstrual tension, but we are talking about the same thing. So, just to start off with, what is premenstrual syndrome? So, it's a group of physical and emotional symptoms that tend to start 1 or 2 weeks before a period, and they range from milder symptoms to actually quite severe symptoms that can even impact people missing work or school. But again, some women are just mildly troubled by it. But it's, as I say, it's a whole spectrum because for some women it's truly debilitating. Now, the majority of women who experience these symptoms are typically in their teens to 30s. There is some anecdotal evidence that these symptoms get better as women get older and also with childbirth. Now, how common is this? Well, according to a 2017 study, 3 in 4 women say that they've had PMS symptoms at some point in their lives. Um, but clinically significant, that's symptoms that are enough to cause dysfunction or problems, are seen in about 3% to 20% of premenopausal women. And it's only less than 5% that get that very severe form of premenstrual syndrome that's called premenstrual dysphoric disorder. Okay, so what are the symptoms? So the physical symptoms, swollen or tender breasts. Some women may get constipation, some women may get diarrhea, cramping. So there's that pelvic cramping. Some women get headaches, backaches. Sometimes the cramping can go down into the legs, into the knees. Clumsiness, just feeling a bit more unsteady. Just a lower tolerance for noise or light. Then you might notice thirst or appetite changes. Some people just feel nauseous and off food, and some people feel like they want to eat more. Some people crave certain types of food that might not necessarily be the healthiest type of food. And then there's fatigue, and some people notice skin symptoms, some people notice bloating. So there's all sorts of symptoms that women might experience physically. Now, there are emotional or mental health symptoms of PMS, and that includes feeling irritable or just not wanting to be around people, feeling a bit angry, sort of problems with sleep, problems with concentration or memory, and this obviously can be really impactful in the work or school environment. Just feeling mood swings, feeling low in mood, sad, just feeling like you just need to cry. And I've certainly experienced that. Changes in your sex drive. So some women might feel that their sex drive increases, whilst others might feel that it decreases. Some might feel less interested in certain activities that they normally enjoy. Anxiety, confusion, and as I say, some people just want to be left alone. And these are some of the symptoms that we notice. Now, what are the causes of premenstrual syndrome? So it's to do with the cyclical changes in estrogen and progesterone, but primarily estrogen. And the changes in estrogen are quite subtle during the menstrual cycle, but enough to produce this feeling or these emotions. And some people who are more estrogen or progesterone sensitive might feel these symptoms more. And actually, it's a good marker for how one might experience the postpartum period, where there are again hormonal changes, or in fact, further on in the future, perimenopausal or menopausal symptoms. Now, also, some women have actual chemical changes in the brain with serotonin, which is also known as the happy hormone, and norepinephrine, um, norepinephrine, which is also known as noradrenaline, which is one of the sort of acute stress hormones. And then existing conditions like bipolar, depression, anxiety can heighten the premenstrual syndrome symptoms. And then if there's a family history, we often see it passed down. So it's not definite, but we see patterns within families. And then again, really importantly or crucially, are lifestyle factors. So physical activity, smoking, alcohol, what you're eating, all of those things can really impact things. Now, what can we do to manage PMS? Well, increasing physical activity, just what we generally try to say is just sit less. Try and just do as much as you can, even if it's just 30 minutes of walking, brisk walking, just any classes. We always try and encourage people to do things that can fit into your lifestyle, so social activities. So, cycling to work, or joining a running group, or a cycling group, or a hiking group, anything that you enjoy. Or if you're somebody who does like solo running or going to the gym, then do that too. Whatever you do that just keeps you active, walk in the park in your lunch break, and just try and do that 3 to 5 times a week. Just keep yourself active, and eat healthy. So good healthy food, fruits and vegetables, varied diet, less white rice, white bread, those sorts of things, and more kind of whole grains. Get plenty of sleep. Try and limit salt, caffeine, alcohol, because all those things can make the symptoms worse. Try and get calcium from your food. So think dairy, or sort of dairy alternatives if you're dairy sensitive, green leafy vegetables, fish, and if you can't afford canned fish is also good. Don't smoke, and really kind of manage your stress levels. We've talked about this a lot, that stress can really heighten the symptoms, and we'll talk about mental load in a minute. Also track your moods and symptoms in a journal, so you get to know your pattern, and you can try over-the-counter pain relief to help with symptoms of pain if you get them. Okay, so now with PMS and the mental load, it's almost like a chicken and egg situation. So a heavy mental load can make PMS worse, and conversely, bad PMS can make your mental load worse. So PMS symptoms can make it more challenging to manage daily responsibilities, tasks, commitments, and that adds to your mental load. And women might feel really overwhelmed, stressed, finding it harder to cope with multiple demands on their time and energy. It can also affect one's ability to focus, make decisions, and handle emotional challenges effectively. So PMS related symptoms can really contribute to an increased mental and emotional burden. And so it's really important for women to practice self-care, and obviously reach out and seek for support, which could include therapy if that's needed. Okay, so how can we as doctors help? So there's quite a few things that we can do. And for severe symptoms, we may recommend hormonal sort of birth control pills to kind of level out your hormone levels to reduce the PMS symptoms. So we might try the combined pill, or the mini pill, but then also things like the coil, or the implant that may be tried as well. And these, work to affect the levels of estrogen and progesterone in the bloodstream and make it more level, because it's these changes that tend to provoke the PMS symptoms. We can also talk about things like talk therapy. So especially for people who really struggle with the mood symptoms, then things like cognitive behavior therapy can be really helpful. And you can have some counseling or therapy support. Or already talked about over-the-counter medication, so things like aspirin, paracetamol, ibuprofen, naproxen. But do remember that aspirin cannot be taken in people under the age of 18, and that's because of a condition called Rye syndrome. So aspirin for only people 18 and over. And then finally, sometimes we might give other prescription medication. I think these would have to be quite difficult or complex cases where we could use things like spironolactone or antidepressants and things like that to help with PMS symptoms. But the point is, there is help. So if you're struggling, seek help. I think that's the biggest take home message from this. Well, I've really enjoyed having this conversation with you. I'm Dr. Show, and this is Dr. Show Cares. We'll see you again next time. Bye bye.